One of the most common themes that the death scene investigators report is that the parents say, this could never happen to us. Well, it can happen to anybody.
I am Mike Miller with the Rosen Aquatic and Fitness Center, and I am gathered here with two very special guests to talk about some drowning prevention points today.
Hi, Mike. I'm Dr. Robert Karch. I'm the director of the Florida Department of Health in Orange County.
Hi, Mike. I'm Dr. Salmon-Trejo, and I manage our chronic disease and violence and injury prevention section at the Florida Department of Health in Orange County.
We'll hop right into it. With drowning being the leading cause of death from ages 1 to 4, and it's a preventable cause of death, what are some of the primary ways to prevent this?
As you said, drowning is the leading cause of death for children in Florida ages 1 to 4, but it's also a leading cause of death among children of all ages in Florida. So it's so important to emphasize the 4 layers of protection. And those layers of protection are adequate adult supervision first and foremost, barriers to entry like pool fences, high quality swim classes like the ones we offer here at the Rosen Center, and then knowing CPR, high quality CPR. Those are the 4 layers of protection to prevent against drowning deaths.
I love that you brought up the classes here at Rosen Aquatic and Fitness Center, because we actually work very closely with you guys with our ECAS program. So when you talk about specific barriers of protection around those pools, we've got Airbnbs in Florida, we've got Verbo, we've got all the different ways that people are renting houses. What are some of those important barriers that should be up around those pools?
Well, first, I would say that if you are a pool owner, taking that responsibility to have any type of shrubbery or some type of agriculture around the actual pool, a pool fence, an alarm, as was just mentioned, locking the pool door and the screen door to the pool.
Now, Mike, it's important to understand that most drowning deaths don't happen during swim time. Less than 3% of drowning deaths in pediatrics happen during swim time. The vast majority happen when the child is not expected to be near the water or in the water. So having those barriers of entry, a self-latching pool gate. First and foremost, all pool owners should have fences around their pool with a self-latching pool gate. Door alarms, window alarms, pool covers, all of these things are essential to prevent the child, the toddler, from straying into the pool. If you've got retention ponds in your community, those retention ponds should have some sort of barrier. It doesn't have to be a fence, but it could be shrubbery, like Dr. Salmon-Trejo said. So barriers to entry are critical because most drowning deaths happen when the child isn't even expected to be around the water. Particularly for children with special health care needs, like those on the autistic spectrum disorder who tend to wander and be attracted to water, those barriers to entry are critical.
How would you define the role of a water watcher? Not every pool has lifeguards like we do here at the Rosen Aquatic and Fitness Center. So really, what are some important key roles for that water watcher when you're out around water?
Well, it's so important that the water watcher is a designated adult, and ensuring that they understand their role is to supervise the child within arm's reach, not necessarily from a sitting position, but to be there, never leaving a child unattended. And that includes at the beach or at bath time and in a bathroom.
We've all been to the birthday parties where there are a ton of adults, a ton of children. The adults are having a good time talking to one another. It's really easy to become distracted, but having a designated water watcher, and we even have lanyards, okay? The designated water watcher, while they're wearing that lanyard, that water watcher has his or her eyes on the kids.
And if you are a water watcher and the doorbell rings, it's important to get the kids out of the water in order to go answer.
Or hand that lanyard to someone else and they become the water watcher.
Beyond swimming pools, what are some other common areas that we're seeing these drownings occur?
Well, as mentioned previously, at the beach, so we know that that can be a risk, but in addition, we know that infants can drown in as much as 1 to 2 inches of water. And so being careful near bath time, even if you're using a supportive infant bathtub or bath seat, to still have that supervision and be there, because the majority of bath deaths occur when the caregiver is not present.
When we look at the age breakdown, when we do these death scene investigations in Florida, under 1 year of age, the drowning deaths happen to be in bodies of water like a bathtub or a bucket. from 1 to 5 years of age, and then again from 5 to 9 years of age, the drownings tend to happen in swimming pools. After 9 years of age, as we get through the adolescent years, natural bodies of water like lakes, oceans, tend to be the site for drowning. So it does vary by age, but again, all the same layers of protection apply. Adequate adult supervision, barriers to entry, high quality CPR, and high quality swim classes apply.
And Mike, I want to mention that even you have these infants that they can tip over, slip out, and in just a few inches of bath water, that's all it takes.
It doesn't take a lot to answer a door, answer a phone call. You think I'll be right back, and you leave the bathroom for even a minute. That's enough time for a newborn or an infant to drown. Drowning can happen in seconds, and unlike in the movies, it's usually a silent event. Okay, so if you're at that birthday party with lots of kids jumping and swimming in the water, lots of adults, it's easy for one child to just slip under and quietly go down under the water.
Why is it crucial for parents of the community to understand that these drowning incidents are 100% preventable?
Well, we really want parents to know, and caregivers and the communities out there, that we really need you to understand the incidents and the risk around drowning and exercising prevention strategies as it relates to being safe in and around the water.
Yeah, when we have our death scene investigations, one of the most common themes that the death scene investigators report is that the parents say, we didn't think this could happen to us. That's the most common sentiment. This could never happen to us. Well, it can happen to anybody. And that's why it's so important. Again, adult supervision, barriers to entry, knowing CPR because seconds count, and then high quality swim classes. But most important, barriers to entry with self-latching gates around all swimming pools, even if you don't have kids.
I know here at the Rosen Aquatic and Fitness Center, we work very closely with the Department of Health, specifically for Orange County. And there are so many offerings that we're doing here just because of the work that you're doing, the swim program, but even the CPR classes. We are teaching CPR classes now for parents that come in and are learning the lessons. So what are some of those topics that we could talk about?
The Florida Department of Health in Orange County is thrilled to be working with the Rosen Aquatic Center. We've had a long-standing relationship at this point, and you are really handling two of the layers of protection. You're handling high-quality swim classes and providing high-quality swim classes, and you're teaching high-quality CPR for parents, and you're training water safety instructors and lifeguards. And there can never be too many of those. And you're also spreading the information about the importance of adequate adult supervision and barriers to protection. So we're thrilled about this relationship. We hope that it continues into the future.
Very excited here as well. So thank you both for joining us today. I appreciate it, and hopefully everybody takes some learning points home and make sure that we're keeping drowning preventable.